Hey everyone, this is Mike. Welcome back. Today we're going to talk about how solution-focused brief therapy, SFBT, might treat OCD. So solution-focused brief therapy takes a distinctly different approach to treating obsessive-compulsive disorder, OCD, than traditional CBT or even REBT. Instead of delving into the why of OCD, its origins, causes, or underlying mechanisms, SFBT focuses almost exclusively on the how the client can move toward a preferred future where OCD is no longer a dominant problem. Here's how an SFBT therapist might typically treat OCD using its core techniques. 1. Collaborative goal setting, defining the preferred future. Best hopes question. The therapist starts by asking the client, what are your best hopes for coming to therapy? This immediately shifts the focus from the problem to desired outcomes. For OCD, this might be, I hope not to spend hours washing my hands, or I want to be able to leave the house without checking the lock 20 times. Detailed description of the problem-free future. The therapist helps the client vividly describe what their life would look like, feel like, and be like when the OCD is no longer a problem or is significantly reduced. This is not about the absence of OCD, but the presence of what they want instead. What would you be doing differently? Who would notice the change? What would you be doing instead of the compulsions? 2. The miracle question. This is a signature SFBT technique. Suppose that one night while you were asleep, a miracle happened and the problem that brought you here was solved. Since you were asleep, you didn't know that the miracle happened. When you wake up, what would be the first small sign that would tell you that a miracle has occurred and your problem is solved? For OCD, this helps bypass the stuckness of the problem and encourages the client to envision concrete changes. The answers provide clear, actionable goals for the therapy. For example, I'd get ready for work in 30 minutes instead of 2 hours, or I'd be able to touch things without feeling disgusted. 3. Searching for exceptions. SFBT believes that even in the midst of a problem, there are always times when it is less severe or when the client is coping more effectively. The therapist actively searches for these exceptions to the OCD pattern. Tell me about a time when the OCD was less intense or when you didn't perform a compulsion you usually would have. What was different about that time? What were you doing then that might have helped? How did you manage to do that? The goal is to identify what the client is already doing that works and to amplify those behaviors. Even small exceptions are highlighted and celebrated as evidence of the client's competence and ability to change. Scaling questions. On a scale of 0 to 10, where 0 is when the OCD is at its worst and 10 is when the miracle has happened, where are you today? If the client says 3, the therapist might ask, what makes it a 3 and not a 2? Focuses on progress, however small. What would it take to get to a 4? Identifies small, achievable steps. What will be different when you move from a 3 to a 4? Who would notice you're at a 4? This quantifies progress, instills hope, and helps break down large, overwhelming goals into manageable steps. 5. Compliments and affirmations. SFBT therapists liberally use compliments to acknowledge the client's strengths, efforts, and progress. This reinforces positive behavior and builds self-efficacy, which is crucial for someone battling OCD. It sounds like despite how difficult this is, you're incredibly resilient. It's impressive that you were able to resist that compulsion for 5 minutes yesterday. 6. Doing something different, small steps. Based on the miracle question, exceptions, and scaling, the therapist helps the client identify small, concrete actions they can take between sessions that align with their preferred future. Given what we've talked about, what's one tiny step you could take this week that would be a step toward your miracle? This might involve a very small exposure, for example, touching a contaminated object for 1 second instead of 0, or waiting 1 minute before checking, or resisting a compulsion for a very short period. The focus is on doing something different, no matter how small. Coping questions. When a client is struggling, the therapist might ask, how have you managed to cope with this so far, given how difficult it is? This acknowledges the struggle while simultaneously highlighting their existing coping resources and resilience. Key principles guiding SFBT for OCD. Future-focused, little time is spent analyzing the history or pathology of OCD. The focus is on what the client wants to achieve and how to get there. Strength-based, the client's existing resources, resilience, and past successes, the exceptions, are emphasized and leveraged for change. Client is expert. The client is seen as the expert on their own life and on what solutions will work for them. The therapist acts as facilitator, helping them discover their own solutions. Small changes lead to big results. SFBT believes even that tiny shifts in behavior or perspective can create a ripple effect, leading to significant change over time. Brief and efficient. SFBT aims to be short-term, focusing on rapid goal attainment and empowering the client to continue making progress on their own. In essence, the SFBT therapist treating OCD wouldn't focus on fixing the OCD directly, but rather on helping the client envision a life without OCD, and then identifying and building upon the steps, no matter how small, that move them towards their desired reality. So what do you think? What do you think about SFBT for OCD, and would you want to do you think that might be effective in treating it? Let me know your thoughts in the comment, and I'll speak to you next time.